ClearPath Surgical presents Unicare, Dr. Lawalia's second-generation uterine manipulator system. Unicare is a component system comprised of a uterine manipulator and a set of dual-rimmed collars having small, medium, large, and extra-large rims with a stabilizer to support colpotomy. The manipulator is intended for manipulation of the uterus and injection of fluids during laparoscopic gynecological procedures. The tip is designed to slide atraumatically through the cervical canal, with double humps to enable clinicians to feel the depth of insertion and resist slippage of the tip back into the vaginal canal. The tip also includes a sidewall aperture for introduction of fluid or dye, unlike balloon tips with distal apertures which may release fluid into the uterine wall instead of the uterine cavity. Unicare also includes a set of dual-rim collars having small, medium, large, and extra-large rims. A collar is first rotated sideways into an atraumatic orientation and then inserted into the vaginal introitus. The collar can then be rotated internally to fit and test each rim around the cervix and fornices. This fit and test system eliminates guesswork and waste resulting from choosing a wrong-sized fornices delineator. In this uterus, the correct rim size is large. Unicare's collars are designed for anatomical precision, accommodating variations not only in the fornices diameter, but also in the cervical length and vaginal wall diameter. This is intended to ensure that the fornices is adequately defined before colpotomy, thereby minimizing the risk of vaginal shortening and the risk of injury to nearby organs such as the ureters, bowel, and bladder. In this uterus, the correct size is small. The collars also have a unique dome shape, designed to define the vaginal wall and maintain pneumoperitoneum. Viewed laparoscopically, the dome shape is visible and is designed to provide a platform for dissection of the bladder flap and obliterated cul-de-sac when required. The collar's rims are designed to define a clear path for the bladder flap incision and colpotomy. This is in contrast to other devices which fail to define the vaginal wall, leading to guesswork on the bladder flap dissection and colpotomy, and an increased risk of injury to nearby organs. Unicare's curved shaft is designed to define the sacral curve and enable manipulation of the uterus anteriorly, posteriorly, and laterally. The collar is designed to define both the anterior and posterior vaginal walls equally, which may be relatively longer in an retroverted or in an anteverted uterus, respectively. In a retroverted uterus, the device is inserted in a reversed orientation and then rotated 180 degrees before the procedure. Other fornices delineators lack Unicare's anatomical precision and may fail to define the posterior or anterior vaginal wall clearly and equally. Unicare, a component system designed to reduce costs, accommodate variations in anatomy, and define a clear path for clinicians.